Today we'll be talking about the elbow joint. The elbow joint is made of two articulations, the hinge joint and the gliding joint. The hinge joint is the trochlea of the humerus, which is found on the medial side of the humerus, and the trochlear notch of the ulna, obviously also found on the medial side of the forearm. This creates a hinge joint. The gliding joint is formed with the capitulum of the humerus, which is on the lateral side of the humerus, and the head of the radius, which is found on the lateral side of the forearm. You can see here, this is the humerus, the anterior and the posterior surface. The anterior surface is on the right arm here. The trochlea is on the medial side, and the capitulum is on the lateral side. Here on the ulna, we see the trochlear notch on the medial side and the head of the radius on the lateral side. The stability of the elbow joint is caused by the ligaments that you can find there. The ulnar collateral ligament, its function is to strengthen the capsule wall of the elbow joint. This structure, the origin, is the medial epicondyle of the humerus. Medial epicondyle of the humerus. And the insertion is the medial margin of the coronoid process of the ulna, which is found here. Here we have the medial epicondyle, here we have the ulna, and here we have the ulnar collateral ligament strengthening this capsule of the joint capsule. The posterior structure of the ulnar ligament is origin, the medial epicondyle, and the insertion, the olecranon process of the ulna. If this was a 3D picture of the arm, humerus, and the radius and the ulnus, the epicondyle would be pointing in the 3 dimensions out this way, and the process of the ulna would also be pointing out this way. So this is the posterior structure of the ulnar collateral ligament. Adding to the stability of the elbow joint is the radial collateral ligament. The function is to strengthen the lateral wall of the capsule. The structure is the lateral epicondyle of the humerus, and the insertion is at the annular ligament of the radius, as you can see here. The annular ligament attaches to the trochlear notch of the ulna, right here, the trochlear notch of the ulna. The elbow joint capsule encloses the radio-ulnar joint so that it functions properly with the elbow. The synovial membrane and adipose tissue help to protect non-articulating bones during movement. movements of the elbow joint, the hinge between the humerus and the ulna. Here's the trochlear notch. Here's the trochlea. The function is to extend and flex the forearm. So when you're thinking of your project on a prosthetic arm, think about this joint and about the ulnar and radial ulnar collateral ligaments that will help to join those bones together. For the gliding part of movements at the elbow, pronation and supination, we have the head of the radius, and that helps to rotate the head in pronation and supination. Right here, the radius, the neck, and the head of the radius. Tips to help you remember some points. The radius rotates around the ulna. The radius rotates around the ulna. The head of the radius is structurally unique to allow for this motion. It is disc-shaped. Notice it doesn't have processes or notches. It's uniquely disc-shaped, and that allows for a swivel or rotational movement between the radial head and the capitulum on the humerus, on the lateral side of the humerus.